Sales and Marketing Office, Centerville House, 2nd Terrace West, 5th floor.
You could have caught a ride with me. We're only a block away from ZNS.
ZNS Sales and Marketing has moved to the 5th floor, Centerville House, 2nd Terrace West. For more information, call 502-3800.
In 1953, the United States began using a female name for storms. And by 1978, both male and female names were used to identify northern Pacific storms. This was then adopted in 1979 for storms in the Atlantic Basin. The National Hurricane Center does not control the naming of tropical storms. Instead, there is a strict procedure established by the World's Meteorological Organization for Atlantic hurricanes. There is a list of male and female names which are used on a 6-year rotation. The only time that there is a change is if the storm is so deadly or costly that the future use of its name on a different storm would be inappropriate. These are the names of the storms for the 2025 Atlantic hurricane season. Andrea, Barry, Chantal, Dexter, Aaron, Fernand, Gabrielle, Umberto, Imelda, Jerry, Karen, Lorenzo, Melissa, Nestor, Olga, Pablo, Rebecca, Sebastian, Tanya, Van, Wendy. This public service announcement was brought to you by the Broadcasting Corporation of the Bahamas in conjunction with the Disaster Risk Management Authority.
At the 66 Steps, I'm Matea Cunningham. This is ZNS.
A quick Google search will tell you just about everything about anything. Just plug in the Princess Margaret Hospital and you'd find that it was opened in 1952 and for 3 years held down the name the Bahamas General Hospital. But there's a side of the multi-winged, greatly expanded facility of which some of us have no clue. And that's the side we'll discuss with Public Hospitals Authority Managing Director Dr. Aubinet Rolle on this week's edition of In Depth. Dr. Rolle, we're just going to dive into it. Wards of the state, a lot of people aren't even aware that this phenomenon, we're going to call it, exists. These are people left in the hospital, and the state now have to take responsibility of their welfare. And we're going to talk specifically about the elderly. How big a problem is that?
Oh, it's a huge problem. You know, I've been in healthcare for more than 4 decades. And so we have seen this from the time I was a nurse at the bedside. However, we've seen a heightened level of patients who have been discharged now being left, particularly those who are 60 years old and over. We do have those who are under that age, but we see it in the elderly population. Now, when that happens, because we are a public entity, we cannot refuse, or what one will call in the Bahamas, throw away patients. So we have an obligation to keep them. One, if their relatives will not come for them, or they don't have a place to stay, whether they are from New Providence or the Family Island, because we have a mix of patients as well. They're not only from New Providence. Also, if there are no places, no facilities that are able to attend to their needs, then they have to remain there. What that means, Macushla, is that we sometimes have to leave them on the general wards where patients are, and sometimes they take up the bed space for those patients who need that emergent in-hospital. And now in this case, we have had to move them to one of our mobile units to care for them. So it's couple-fold there. You have the patient who remains and really want to be in their own environment but don't have a choice. And then you have also the movement of staff to be able to attend to them. And it's very costly, it's time-consuming, but more importantly, it has such a psychological impact on these persons. And so it's a huge problem. We don't have space. We've had where we've entered contracts with persons on the outside to attend to them. They are full. And in some instances, we cannot even get these patients into homes because they have other problems. So, for example, you know, somebody's discharged, they have all of their take-home medication, but they have some level of incapacitation. So, say they are an amputee. Well, you have some of the homes, they have criteria for admission, and they cannot care for these patients. So therefore, you know, they remain on our doorstep, and we have to care for them.
We're going to dissect all of what you said just now. What are some of the reasons you've come across that family members actually leave their elderly loved ones in the hospital? I know you referenced the fact that some of those, they need specialty care.
Right.
That would cause family members to, let's say, hire a nurse of that nature, things of that nature. But what other reasons have you come across?
So in having conversations with both the patient and the relatives, and sometimes with the nurses who are at the bedside, and they're the ones on the ground having conversations with relatives, we would hear things like, well, you know, we didn't anticipate this. Sometimes the home for which the patient came from is not in the state for them to return. And sometimes you have to make those adjustments if you're now going to become the caregiver. We have family members sometimes who say, well, we can't take them today, but just give us a few weeks to be able to reorganize. Now, we have instances where they did do that, but we also have instances where they don't come back at all. So it's either, you know, where they are is not acceptable for their return. Loved ones and friends and families say that they cannot house them. In some instances, they don't even have the space to house them. And sometimes we just don't have an answer. We actually have patients too who get their relatives visiting them, but they still refuse to take them home. And so it's very unfortunate for them.
Is it that these patients, the wards of the states, the elderly people, in this case, all of them are patients, or some of them are actually just dropped off one day and PMH has to make way for them, take care of them?
Well, we have had instances where persons were dropped off to the emergency room by relatives, friends, loved ones who said that, you know, they had some complaints that needed to be attended to. We have seen that happen mostly during the holiday season. So anytime after the U.S. Thanksgiving and after Christmas, we've had elderlies who have been dropped and not picked up. But the majority of the patients, 99% of those patients are those patients who had care, access care, were inpatients, and then they were left even after discharge and notification to the family or next of kin.
You noted the cost that comes with this, that this is costly on the, in the long term, the government or the taxpayers. What are we looking at in terms of taking care of this grouping of people every day?
Yeah, I think if we concentrate on the elderly as it relates to what are going to be some of the priorities moving forward for them, it's really going to be finding places that can assist them. We hear about it, we read about it. Some of us have visited before in our travels assisted living for these type of patients. These are the patients who have completed their course of treatment in hospital, but sometimes need that continued medical care at a very low level, but they need that support. So we need to be looking at assisted living. doing, working together with all partners, so social services, other elements of it, to get that level of support, because no social service will be able to attend to all of the needs of individuals. We know that. So we need the support of loved ones and family members. But also, an important note here, we are living longer. Data supports that. So what it means is the longer we live, and you know, I'm not a physician, but I've been in healthcare long enough, and some of it is just a common sense principle. The longer we live, the more exposed we're going to be to certain things, which include illnesses. Right. And so with that in mind, and also seeing an increase in early onset dementia and Alzheimer's, we now need to be talking about how we're going to care safely for these individuals. Do we have sufficient housing? Are we at a stage now where we do have facilities and we need to get support to be able to move them to a level to care for them? Because when you have certain criteria, you cannot take on a patient if you don't even have basic ramps for wheelchair. The normal ADA process for those patients going to the bathroom. If you don't have specialized care to be able to give them their insulin and their medication. Because when you now force persons to take on those responsibilities, two things happen. Either the patients don't get the level of care, or eventually that business will close because they cannot support the payment of those high-level professionals to care for these patients.
Have there been talks on a higher level in terms of providing assisted living? I know a lot of the onus should be on the relatives of this grouping of people, but have those talks taken place in terms of what could be done, let's say, at a government level?
Yeah, we have started that conversation, and the conversations are always aligned with what the data shows us. And the data has shown us that we are living longer, and also persons with the illnesses. So we've had that conversation. I know Sandilands Rehabilitation Center and the psychologists and the psychiatrists and the entire team have spoken about that. Because even if you look at the geriatric population, there's a mix there. They're not only those persons with the aged elements, the natural process of aging, but they're those persons with the same Alzheimer's, dementia, those persons who were there from very small, who have congenital anomalies. All of them are being housed there. And nowadays we get calls for placement for those persons who have not even reached the age of 65. Right? And it is so full, the only entry to there, the only space you have is after the demise of a patient who's already been there.
What do you think, we're going to go back to a point you made, we've dealt with the expense of this to the state. What about the expense to one's mental state? And I'm talking about to your staffers, those staffers who have now had to be displaced and moved, relocated from this place to this place just to accommodate patients, long-term patients.
Sure. I think from a psychological and a mental standpoint, I think it's affected on both ends. That is the caregivers, which are our employees, because when you have been in a place so long, there's a bonding that happens. And you sort of take on the burden. And myself being a nurse, I understand that you want the best, especially if you have minors and even the elderly. You know, in the Bahamas, we're very sensitive when it comes to children and older people. And so that psychological effect of seeing persons there, sometimes expressing and yearning to go home, go back in the environment, is very traumatic, but also for the patient. You know, the patients, I always tell people, patients don't come to hospital because they want to come here. I always say they don't come here just to get the hospital bread. They come there reluctantly, sometimes with pressure, because they need the care. And when a patient is told that I am now discharged, there's a sense of joy that comes because I want to go. And when every day you're being told that you cannot go and nobody came, and can you call my sister, my brother, my child, and nobody coming, when you see the tears of them, it really, really hurts. And so the patient as well as the caregiver is really affected by that emotionally and psychologically.
You're watching In Depth. When we return, you'll hear more about wards of the state, particularly seniors.
The Public Hospitals Authority wishes to ensure that you and your family are safe and prepared during the hurricane season. There are a few simple rules to follow that will help you to better manage your health during a storm. Ensure you have a 2-week supply of any medications you are taking. Ensure you have a first aid kit. Ensure you make contact with your healthcare provider to reschedule any appointments or procedures that may have been scheduled ahead of the storm. The public is reminded that ambulance services are only provided to service medical emergencies. The National Emergency Medical Services advises the public that once winds exceed 50 miles per hour, ambulance services are discontinued until the all clear is given.
You don't have necessary skills for employment, and not just that, you don't have the necessary attitude and behavior.
This week, we examine the latest unemployment numbers, what they mean, and why it's not exactly a simple issue to fix.
As people get older, they get steeped in some ways. No 14 weeks in this world or the next will change them.
We tackle that and more on In Depth with Macushla Pinder. Now, Dr. Rowe, wards of the state are just not specifically the elderly. There are children in that grouping as well. What happens in the case of youngsters?
Sure. So the youngsters are a little different. We've also always had wards of the state of the minors and those persons under the age of 16. In my time, you used to see a lot of them from birth. Where birth mothers leave them for various reasons. Sometimes it's cultural. You know, you have some person's belief of if a child has a certain congenital anomaly, that it's a curse and therefore they're left. And then persons are left also when they would have been in there for care and parents just did not return. We've also had some cases where persons delivered and they've said up front that they are not able to take the child home. When that happens, of course, we have a responsibility to advise our various partners about that, which also includes the police, social services, all of that. And our obligation is the same. We have to care for them straight up to the point where they are removed from us through social services into a safe space, like the Ramford home, other places. So some of them move very young, and some of them even up to the age of being teenagers. And so a lot of times they would be housed on children's ward, and in some instances, depending on their physical ability or mental state, they have also moved up to Sandilands.
And before we get to that part of it, how prevalent is this particular problem? Is it more of an issue than in the elderly patients, or they balance themselves out?
So presently, if we look at the data in terms of what we have in-house and over the past 3.5 years under my leadership, we have seen a growth in the elderly, not particularly a growth in the children, but we see children there, and we have also children who have remained there for years.
Now, you said these numbers particularly increase over the holidays. Any stats in terms of where we sit right now, in terms of youngsters, in terms of elderly?
Not in stats of who left. Now, we don't see increase in the young ones during the Christmas or celebratory season. We see that with the elderly. And you know, we've looked at data just a few years ago, and you would normally also see a drop-off just before Junkanoo. It's amazing because persons want that relief to go out and, I guess, have fun over the holiday. But is it really fun when it now becomes the burden of somebody else and a loved one not even having the ability to spend time with family, whether they are going to enjoy a good Christmas dinner or whatever? Regardless, being in a strange place is really burdensome.
How do the PMH make it work in terms of the youngsters? You're not seeing anyone come to you, and we're not talking about the babies, but the ones who can understand and process what it is. Well, see others come there, other parents come there to other children, and no one's coming to me. How does PMH make it work in terms of, hey, we're your family, if only for now?
Well, I can tell you, I was a nurse, and that has not changed. You know, over time, healthcare has changed. But I can tell you the love and support that the children get from the staff themselves is unbelievable. We have staff, not only the ones who work on children's ward all over, who would bring them gifts, bring them treats, come and care for them, bring them clothing. In some instances, with the right permission, they're allowed to take them out to different, events. And so they get all the love and support. Persons know those ones who have no families coming to them or really, to receive anything from them. They get gifts for Christmas, all special occasions, their birthday. We do the natural throughput of a patient who is young and would have been home. What do I mean by that? As that child evolves in age and is now to the age of needing education, we also have a school in the hospital.
Wow.
Yes, that really assists not only those persons who home is the hospital, but for those who are there because of illness and they cannot go to their regular schools, they can get that level of support. So we care for them the same way.
Are your nurses, healthcare workers, given first preference? Because you spoke of adoption. Are they given first preference and when it comes time, or in terms of who adopt these children?
So I would not know the strategy that's used for selection, but once they meet the criteria of the adoption process, I believe that they are given first preference. I can also say, sitting here, there was a child that was left. It was noted that they could not take the child home. And I'm actually the godmother of one of the adoptive children through a hospital stay.
In doing research, I see in the United States there is this trend, for lack of a better phrase, where you can adopt a grandparent. Do you think that we should be moving in that direction to at least ease the burden on the public health care system in terms of the care and the finances, the emotional toll that it must take on your staff?
Absolutely. I think what the U.S. is doing and other countries really works well, and I think we can only benefit from it. I think any partnership, any public-private partnership that we can do to support, and so we may seek to do that, because you see that in cancer cases, support this child, this really goes. You see it in other third world countries where, you pay this amount and this support. So I think what really needs to happen now, because of the aging population and the crisis we face now with those persons we deem boarders, because that is really the title of those patients, boarders. Those boarders are individuals who are remaining in the healthcare system, but they are not there for medical services, okay? And so we need to have that very frank conversation about the next steps. How do we work together in partnership where the finger is not pointing at health, the finger is not pointing at social services? How do we get together to fix a country solution? And how do we get persons really to empathize about what's happening now in country?
Finger's really pointing at you.
It's really pointing to us, because it's a concern for us, because everything that's happening is related to us. Even if we look at the data, the majority of the people are Bahamians. You will always have a mix of culture, but the majority of the Bahamians. But how do we fix it for all? And even if partnership is in other countries, how do we work with that to foreign affairs to deal with those individuals, to be able to get them to their place of domicility? Because you have visitors and persons who are away who are also left here for a while, and then we have to work with the various agencies to see how to get them out.
Are those talks taking place?
So we've
We've
started the conversation, because we've now seen an increase in the data. So we're having those conversations. So we're looking forward, and I can say we've had good conversations with social services in relations to coming together with those levels of support. And I think when we look around all of the agencies, when we talk about care, we also have to have the human capital for that to happen.
Exactly.
Right? And they have to be well trained in all aspects. So we're looking at, social workers to deal with the cases. So the numbers, the nurses, psychiatry, psychology, all of those elements. The special ed teachers to be able to support persons. And so we have to look at it from a 360 standpoint, and how do we partner? For me, the word is really partnership. How do we do it to be able to move forward and to provide?
Do you have the dollars and cents in terms of what it takes on a daily basis to care for these particular patients? And I know it would vary depending on what the patient is in there for, if it still needs specialized care. Any dollars and cents, any
we
financial?
We don't have dollars. I can't sit here this morning and say that I have dollars and cents for that population, because they're really outside of medicine. So we're really attending to what we call their basic needs. So it's their meals, their baths, their movement, that sort of stuff, washing of hair, if they need a haircut, those basic things that you would do if you were at home. And that is separate than filling their medications that one would naturally do if you're out of hospital and you have to continue on the medications. That's a bit different.
You speak of the increase. We've heard increase from the beginning of this discussion. How would you describe that increase? A troubling increase, worrisome increase? Is it to a level where it's inching closer to we can't take any more?
Well, I can tell you, we cannot take any more. We're at the point, the house is full. And so not only are the mobile units full, but the inpatient is full because we have nowhere else to send them, particularly those who have other challenges and cannot get in the homes. Because remember now, when a patient gets in the home, only two ways for them to get out. Either a loved one, a friend, or somebody comes and removes them, or they die there. If we're waiting on death, that is undetermined. And so we have to care for them. So right now, we're at the point where it's a lot, because we're not only providing medical care to the best that we can, but we're now really being sitters of individuals who should really be in their space and being cared for and enjoying the latter days of life.
Well, we heard a lot about borders at the Princess Margaret Hospital, but that's certainly not the only issue gripping the public healthcare sector. We hear more about that next week.